Hi, this is Dr. Jonathan Kuttner. We're going to talk about dry needling side effects. So dry needling is something that's now spread throughout the whole world, and it's the use of very fine little needles which previously were used for acupuncture, and now the real secret is it's dry because you don't inject anything through the needle. So it's a fine little needle that's stuck into your body primarily for treating pain. The side effects of dry needling, I'd see really three big groups of side effects. The commonest are just local side effects, and some of these are so common that you can almost say that they're part of the treatment. So for a very high proportion of people, there is a little bit of pain as you pop through the skin, and then as you hit the trigger point, which is because you're treating trigger points with your dry needling, as you hit the trigger point, you have a sensation of pain. And that is the first. The second side effect, which is almost as common, is that after your treatment, you have a feeling of discomfort. In fact, you may feel that whatever you came in for is slightly worse. And this is really common, and in fact it's not a bad thing at all, but it is a side effect of the treatment, and in the majority of people this gets better in a day or two. Some people, you may actually hit a blood vessel, and as you hit a blood vessel you'll get a local small bleed, and therefore you may get local bruising. Again, very common side effect. So these are just local. If you're incredibly unlucky, you may get infection, but this is rare because the majority of people use throwaway needles. The second group of side effects are more general, and these come from often people have an unrealistic, it's probably a good word, unrealistic fear of needles. And this comes from when they were children. They had some awful experience. And so as somebody approaches you with a needle, you turn on your fight and flight response. You think, what am I doing here? And your lizard brain inside says, let's get out of here. Now what happens when somebody then puts a needle, especially if you're sitting up, when you have the treatment, is that your heart rate starts beating really fast, you feel dry mouth, you feel dizzy, and you may even faint. You feel incredibly unwell, you're sweaty, and so this is a side effect that can occur, and it can be completely unexpected out of the blue. So the clever thing to make sure that this side effect occurs as little as often is to make sure that you're lying down when you have your treatment, that you tell your practitioner that you actually have this fear of needles, which comes from way back, and that the practitioner uses as few needles as possible, and their insertion is as excellent. You can have a virtually painless insertion. So that's the second group. The third group of side effects is that the practitioner puts the needle where they shouldn't. So here what they do is they poke the needle into an organ. Now the most common is your lung, because your lungs actually sit that bit just very shallowly underneath your skin in your chest. You've got your ribs and you've got your lungs around the side and around your back. So this whole thoracic area, the lungs sit just underneath it, and if you puncture the lung, that's called a pneumothorax. Now that sounds really dramatic. Oh, I had an acupuncture, or I had a dry needling session, and I ended up with a pneumothorax. The truth is, it's such a tiny little needle that if the practitioner does actually cause a pneumothorax, usually it's actually mild. You have some discomfort, you may feel slightly short of breath, you have pain as you breathe. The practitioner needs to clearly acknowledge that they've caused a pneumothorax. You have an x-ray, and the x-ray will show a tiny thin little band of air where it shouldn't be, and then over a week, that will completely heal up and be reabsorbed, and there's no long-term problems from it. You may also stick a needle into, I suppose, your heart. Not a good look. That would be absolutely incompetent. And sometimes doing deep needling around the back, the practitioner may stick a needle into the kidneys. Not a big deal. Into your gut. That's pretty silly. I'm incompetent again. But again, except for the heart, none of the others turn out to be significant as a long-term problem. So the side effects the mild side effects are pretty common. Most of them all go away, and the less common side effects, the vast majority of them are actually fairly minor. Thank you.